All right, Michael, we're good to go.
Good morning. Welcome to everybody, and thank you all for joining us today. I'm Michael Shifter, president of the Inter-American Dialogue, and the Dialogue is very pleased to host this important and timely discussion on the state of the economic recovery in Latin America and the Caribbean, with a particular focus on healthcare investments that could help accelerate that process. Additional investments, as we know, are urgently needed to improve health systems in the region that have been weakened by the COVID-19 pandemic. According to Carissa Etienne, who's the director of PAHO, the region's governments need to increase public expenditures in their health systems to at least 6% of national GDP and ensure that 30% of this funding is directed to first-level care. Achieving this goal, however, will be a tough challenge. In the context of shrinking fiscal space, governments confront difficult choices and spending decisions. And with competing demands from other sectors, it remains unclear whether the region's countries will be able to give priority attention to health spending and how they can achieve the biggest return on their investments in health. Today, our panelists will discuss how investments in the healthcare sector might help build economic resilience and spur growth, the consequences of not investing in these services, and also explore examples of public-private collaboration that should be extended beyond the pandemic to bolster the region's economic recovery at higher rates. I'm delighted to introduce our moderator for this session, Araucho Castro, who's the Samuel Stone Chair of Public Health in Latin America at Tulane University. Her very impressive bio, as well as that of other speakers, are available on our website. Araucho will be introducing our other speakers. Unfortunately, I want to mention that Uruguay's Minister of Health, Daniel Salinas, will be unable to join us. He sends his regrets. At the end of our panel discussion today, we hope to hear from our participants with your questions and comments. Please submit questions using either the Q&A function in Zoom or by emailing meetings@thedialogue.org. Finally, I want to remind you that all of you that the interpretation in English and Spanish is available for those joining via Zoom. Please click the interpretation button in the black bar at the bottom of your screen and select your preferred language. As always, we extend our deep gratitude to our corporate program members. Their support makes substantive exchanges like these possible. And finally, I want to extend special thanks and recognition to Eric Brand for his leadership of the corporate program and for putting together this terrific event. And as always, to Kate Blancett for her great assistance and support. So thank you all very, very much for joining. I look forward to a terrific discussion. And with that, I'll turn it over to Araucho Castro.
Thank you very much, Michael. The COVID-19 pandemic has undeniably exposed the limitations of Latin American and Caribbean health systems, the strengthening of which cannot continue to wait or depend exclusively on the budgets allocated during the pandemic. Before the pandemic, only Cuba and Uruguay met the 6% GDP recommended by the Directive Council of the Pan American Health Organization, followed closely by Costa Rica, Argentina, and Chile. The political instability that preceded the pandemic in countries in which the population demanded more redistributive and fair social policies, together with the devastating impact of the pandemic, create the ideal conditions for governments to justify spending at least that 6% of the GDP in health and to fund other social policies, despite the economic contraction that has resulted from the pandemic. Doing otherwise would not only set back hard-won health and social gains, but would exacerbate the current crisis and prevent countries from being prepared for the next pandemic or humanitarian crisis. I would like now to introduce Dr. Yajaira Bastardo from Venezuela. She is a professor of pharmacoeconomics and pharmacy administration at the Central University of Venezuela in Caracas. She also teaches graduate courses in pharmacoeconomics in the Sanitary Surveillance of Medicine program at the National Health Institute Rafael Rangel in Caracas. She has like all the speakers today, a very long CV. I would just mention that she received a bachelor's in pharmacy from the Central University of Venezuela and completed a PhD in pharmacy healthcare administration at the University of Florida. So, Dr. Bastardo, please welcome.
Gracias, Aranchu. Para mí es un placer aceptar la invitación del diálogo interamericano para esta conversación sobre salud y economía en América Latina y en el Caribe. Estamos en el tercer año de la pandemia del COVID-19 y esta pandemia quizás es el evento, la emergencia en salud pública más importante que hemos enfrentado durante este siglo 2021, con cifras que reporta la Organización Mundial de la Salud en marzo de casos confirmados que superan a 450 millones de personas a nivel global y con un número de muertes que excede ya a 6 millones de personas. Las Américas ha sido una de las regiones más afectadas por la pandemia. De hecho, tenemos según la Organización Mundial de la Salud, el 30% de los casos confirmados están en las Américas y el 40% de las muertes corresponden a las Américas. Esto puede significar de que la región no estaba bien preparada para enfrentar una emergencia sanitaria de tal magnitud. Y de hecho, la región de Latinoamérica y el Caribe es una región muy diversa, tanto en área, en densidad de población, en el tipo de población, en las características demográficas y socioeconómicas, y también en los sistemas y la cobertura la cobertura en salud. Eso refleja las diferentes capacidades que tuvieron los países de la región de reaccionar a la pandemia. Y si lo vemos en función de la vacunación, vemos que muy pocos países de la región lograron cumplir la meta de la Organización Mundial de la Salud de tener el 70% de la población vacunada en forma completa. Mientras que la mayoría de del resto de la región apenas se acerca al promedio global de 60%. Entonces la pandemia nos encontró en diferentes condiciones con diferentes capacidades y preparaciones para enfrentar. Este desafío continúa y la región tiene unas limitaciones para enfrentar los desafíos que las consecuencias financieras y económicas de la pandemia han traído, como es la falta de capacidad técnica, la fragmentación de los sistemas de salud, la falta de datos, la falta de los incentivos adecuados. Entonces, esto hace un contexto de escasez de recursos y alta inflación que deriva de la afectación económica que ha tenido el mundo con la pandemia. Y esto requiere la implementación de estrategias que permitan una utilización racional de los recursos para que nosotros podamos hacer una mejor utilización de los recursos y lograr las metas de desarrollo que tenemos para el milenio. En este contexto y dentro de lo relativo a la economía de la salud y la investigación de resultados, Me gustaría enfatizar algunas de las opciones que tenemos. Uno es la evaluación de tecnologías sanitarias. Ya la Organización Panamericana de la Salud en 2012 recomendó la adopción de esta estrategia. Y esta estrategia, aunque hay diferentes grados de desarrollo y de adopción en la región, ha sido muy utilizada o ha sido utilizada para hacer acuerdos de compra, bien sea centralizados o regionalizados, y también para la evaluación de esquemas de riesgo compartidos en la región. Entonces, esta es una de las herramientas que tenemos disponibles para hacer una mejor utilización de los recursos. La segunda herramienta es la creación o el establecimiento de marcos de valor. Nosotros sabemos que la oferta-demanda que normalmente establece el precio en los sistemas normales no funciona en los precios de los sistemas sanitarios por las fallas del mercado de la salud. Entonces aquí nosotros tenemos que establecer precios usando otras herramientas, una de las cuales es la evaluación de tecnología sanitaria y muy utilizado los estudios de costo-efectividad. Sin embargo, estos estudios no son aplicables a todos los casos. Nosotros tenemos en casos donde puede haber la necesidad de usar otros criterios debido a, bueno, enfermedades huérfanas, enfermedades de gran mortalidad, enfermedades que afectan a parte de la población que puede estar desprotegida. Entonces, en este sentido es importante el establecimiento de marcos de valor que establezcan cuál es el valor de estas tecnologías para la sociedad. Y en este sentido ha habido avances en la región, ha habido varias organizaciones que han propuesto marcos de valor en Latinoamérica. El tercer punto que me gustaría resaltar sería el real world evidence, las evidencias del mundo real. La pandemia ha demostrado que las evidencias del mundo real pueden ser utilizadas y esto nos ofrece la posibilidad de disponer de datos oportunos y de bajo costo que permiten hacer estudios en subpoblaciones, que permiten toma de decisión de acuerdo a las evidencias reales y que permiten hacer algunas decisiones no cubiertas por los estudios clínicos aleatorizados, que es el estándar normal. Entonces, esto es una de las herramientas que podemos usar, y dentro de la pandemia también se ha reflejado la necesidad de usar también datos del mundo real, no los que estamos nosotros normalmente acostumbrados a usar como registros de pacientes, sino también datos del mundo real que provienen de las redes sociales y que pueden tener un lugar en la pandemia. Además de estos tres elementos importantes, yo pienso que hay que buscar la manera de financiar o cambiar prioridades en financiamiento para cubrir dos aspectos que la pandemia trajo a colación y que van a ser y son muy importantes. Se aceleró su implementación. Uno es el potencial de la utilización de la telemedicina, y el segundo punto que yo creo que amerita buscar las maneras de lograr el financiamiento es la parte de la salud mental, la cual ha sido una de las afectaciones más grandes en la pandemia. Bueno, esto sería mi introducción. Muchas gracias.
Muchas gracias, doctora Bastardo. I'm going to introduce the next speaker, Antonio Vergara from Mexico. Is president and head of diagnostics for Latin America at Roche. Based in Panama, Roche Diagnostics Latin America employs more than 1,400 people and maintains more than 100 distributors with a presence in more than 30 countries in the region, including the Caribbean. Vergara has spent most of his career with Roche, holding positions of increasing responsibility across their 3 divisions and numerous locations globally. He's a certified public accountant by training and holds a CPA degree from the Escuela Bancaria y Comercial in Mexico City. Please welcome Antonio Vergara.
Yeah, thank you very much for a nice welcome. A pleasure to be here with all of you. Healthcare is at the center of every conversation, and that is really a great thing. And quite honestly, a tremendous opportunity that we'll have to highlight how smart investments in healthcare can really positively impact the economies. Actually, according to the report from WHO, health spending has dramatically increased in 2020 in comparison to previous years. But this might be true for high-income economies, but not that much for low and middle-income countries like the ones that we have here in Latin America. The recent focus on healthcare has begun to shift from being perceived as a healthcare from expenses to something that is more important, that is being perceived as an investment. Although there is still a long way to go, I have to say. What I really applaud, and it was mentioned before, the PAHO initiative on increasing to at least 6% of the GDP investment in healthcare, and having that from that 30% to be spent on primary care. But let me combine this with what happened with the pandemic, and we all agree that the pandemic has brought a lot of bad things for society and the world overall. But if I have to rescue something, I would say that I would pick the value of diagnostics. Before the pandemic, almost nobody was talking about diagnostics. And all of a sudden, we have a lot of experts around the world speaking about PCR, antibody, antigen testing, and all those sort of things, which is great. The interesting fact is that 70% of the clinical decisions are made based on diagnostics. But only 2% of that total healthcare expenditures are invested in diagnostics. And actually, Latin America is fundamentally even lower than that. It's only 1%. And we have countries like, for instance, in Brazil, with populations of more than 200 million people spending less than 0.5% in diagnostics. So I would say that if I go back to my early comment of the relevance of investing more, I think it's just not important to invest more in healthcare, but to invest better. How do we make sure that we shift to have a more preventive kind of action? There is a lot of things that we can do way much better if we're preventive certain diseases that we have. And actually, if we go back to the lessons of the pandemic, or some of the lessons, there are plenty of those, is that one of the first ones that we have to go back is the relevance of investing for the future in infrastructure. When we were not ready for that, it was evident that the fact of not having the technology ready for being used, in particular at the very beginning with PCR, was fundamentally important. I remember that I used to receive a lot of phone calls from a lot of different stakeholders, private and public. It's like, how is Roche going to help? How can we contribute to that? And we really want it, right? But the infrastructure was not ready. Just to give you an example, we had the most automated system to actually run PCR, but we have about 10 platforms in Latin America, where in a country like Switzerland, with significantly less population than the entire population of Latin America, had 20 times, 100 times more than what we have here ready to run. So that speaks a lot about the relevance of having the infrastructure. I have not received one single call. How do we keep preparing the infrastructure for potential pandemics to happen or unknown emergencies? I hope that we can keep the dialogue on those preparedness. In terms of the innovation, I would say that we are fully committed in Roche for the innovation. It's such that 20% of the revenues of total Roche is invested in research and development. And that, for instance, if we take 2021, that is about 13.8 billion Swiss francs on 1 year. That puts Roche in the very top of investors in research and development, not just of the industry, but actually across all the different industries. And that is extremely important. So the message here is that we need to keep pushing ourselves, Roche, for keep on investing in innovation. And we need to work together with all the different members, all the different actors, stakeholders, particularly regulatory, to make sure that innovation is available to all the population as soon as we can. We had a very good collaborative approaches with different regulatory bodies in the different countries, where we were able to make sure that we make available the different things that were coming up. More than 15 different tests that we were able to come up with were available right away. Lately, not that much. For instance, the antigen testing for personal use, self-testing, whereas in Europe was available and they gave access right away. We actually took a little bit longer than we probably should have taken to actually benefit the different populations. So thank you very much for all the regulatory bodies, but we can keep consistency in making sure that we get access to everything as soon as we can. I guess the third lesson is the collaboration that we actually were able to see. It was clear that diagnostics per se, it was not going to be the solution. It was going to be part of the solution. Even vaccinations is not the solution, it's part of the solution. When we have even more treatments, more medicines, it will not be the solution. So this is a call to action for a more faster way to find those collaborations and create the famous ecosystems that we've been trying to establish. For example, back in 2021, when the world was waiting for the development of vaccines for COVID-19, in Brazil, we collaborated with Butantan Institute to evaluate the immunization generated by one of the vaccines being developed at the time. On the other hand, we also partnered with the Red Cross in Ecuador to carry out pre and post COVID-19 vaccination as a controlled testing and therefore determine the effectiveness of immunization. These efforts were especially important at the point in the evolution of the pandemic, as they gave us necessary certainty to scale vaccination to massive levels. So I think, again, the message is just to make sure that we continue this shaping of the ecosystems. Now, one of the comments that I always like to make, and we go back to the learnings, we need to apply the learnings of the pandemic to other diseases. And in particular, but not necessarily only, for non-transmittable diseases, cardiometabolics, oncology diseases. We know that, I always used to say the same thing, like, well, when we were in the midst of the pandemic, we have a lot of lockdowns. But those diseases, they were not in lockdowns. They were evolving and they were attacking a lot of the different populations. So again, it's a call to action to continue investing in health, in prevention. We have, for instance, let me take an example, cervical cancer. It's the most preventable cancer that we can have. And no woman should die of cervical cancer. You were able to have a molecular testing, able to trace all the different women that we have in the targeted age. We should be able to prevent it. And that is the only way that we can have diagnostics, monitoring, treatment, and so on. So there is a lot of things that we can do if we actually provide that shaping that we were talking about to the healthcare ecosystems. As the region continues to recover from COVID-19 pandemic, we see a unique opportunity to continue our efforts towards a resilient health ecosystems in our region. To achieve this, we need to rethink our approach to health economies and ecosystems, including supply chains, regulatory issues, digital health, financing, and way more. We are absolutely committed to deliver innovation and work and shape by being part of these new ecosystems by establishing strong partnerships in both public and private sectors. And I really look forward to working with our colleagues here and more today and within the region or outside the region to develop a sustained dialogue and action to create a better healthcare ecosystem. And it's been a pleasure to be here and looking forward to the dialogue. Thank you very much.
Thank you very much, Antonio. And I'd like to introduce now our third speaker, Dr. Javier Guzman from Colombia. Javier Guzman is the Director of Global Health Policy and a Senior Policy Fellow at the Center for Global Development. Previously, he was a Technical Director of the USAID-funded Medicine, Technologies, and Pharmaceutical Services Program at Management Sciences for Health, working with over 20 governments in Africa and Asia to build their health systems and ensure sustainable access to an appropriate use of safe, effective, quality assured, and affordable medicines and pharmaceutical services. Dr. Guzman has held numerous roles in the United States, the United Kingdom, Australia, and his native Colombia. And in addition to his medical degree, he has a master's in health policy planning and financing from the London School of Economics and Political Science and the London School of Hygiene and Tropical Medicine, and an executive MBA from the Australian Graduate School of Management. So Dr. Guzman, welcome to the discussion.
Thank you very much, Arachu. It's a pleasure to be here, and thank you for the invitation. I want to go back a bit about, talk a bit about, the financing, the big question, the elephant in the room, and we heard, the target of the 6% in terms of the spending, and the question of whether governments are looking at health in terms of an investment rather than expenditure. And unfortunately, I don't think governments in Latin America have changed their perspective. Even though there's a lot of conversation about, healthy people build healthy economies, which in turn invest in better health for their people, we don't see that. And I'll give you 2 points, for you and the audience to consider. The first one is the response to the pandemic itself. And the second is the perspectives for the future. So in terms of the response to the pandemic, the Universidad de Antioquia in Colombia did a study with data from the IMF. And basically they found that, countries have overall increased the general government expenditure, not just, overall across the board. And we heard from Antonio that, health expenditure had increased in 2020. And of course, governments did that to protect people, jobs, firms, and to fund some of the work in the health sector. But interestingly enough, we have 2 sides of the spectrum and both are negative. So on one hand, you have countries like Ecuador and Mexico spending only, less than 1% of the GDP on the pandemic, less than 1% of the GDP. And that's across the board. That's not just health. So what can you really get with, that level of investment? So of course, if you're not investing enough overall, the investing in health is very low. Understanding that, we have a crisis with systems that are fragmented, you have a lot of out-of-pocket expenditure, and, a lot of citizens that could fall into poverty. But on the other side of the spectrum, you have countries like Chile, like Brazil, like Peru, spending a lot of money in the response. So you see Chile spending 14% of their GDP, or Peru spending around 8% of their GDP overall. And what you see there is that the expenditure on health is extremely low as a percentage of that, overall expenditure. Chile, for instance, invested only 1%, 1% on health. And that is, that overall expenditure, it is extremely low. Peru spent about 18% of the overall expenditure. But what I'm saying is governments didn't prioritize health in the response to the COVID pandemic. And that's a missed opportunity. Of course, what we will see I mean, we saw some countries in the middle, like, Colombia, Bolivia, Panama, spending about 4% of their GDP and spending about, 25% to 50% of that investment in health. So that is, kind of like in between. But my overall point in terms of the first one is the response to the COVID pandemic clearly demonstrates that health has not been a priority, and health is still seen as, expenditure and, something that is, added to a broader set of investments that are more important. The second point is about the perspectives for the future. And the perspectives for the future, we are expecting most countries in Latin America to, reduce their expenditure. So reduce the overall government expenditure and reduce their health expenditure after the peak in 2020 that we saw. But we, using data from the World Bank, can say that 12 countries in Latin America, 12 countries, including Mexico, including Bolivia, including Ecuador, including Costa Rica, are not expected to spend, what they were spending before the pandemic in 2019, in terms of the overall per capita government expenditure. So we're talking about countries that are not going to be able to even get to the government expenditure they had in 2019 until after 2026. So we gotta see, all these, 12 countries that are in a very difficult situation, and health is not gonna be, the health expenditure is not gonna increase. So my overall first reflection in terms of health and the economy and financing is the pie is still very small. Priority has not been given to health, and that is a big problem. And we need to work with our governments to really understand that health is an investment, and the window of opportunity is closing. And of course, the situation in the future is not going to be easier, but it's going to be more difficult. But it has to happen. Now, if you look at, we heard from, it's not just about raising money. It's not just about having enough money. It's about how you invest. It's about being smart in the way you invest. And we heard about health technology assessment. And I guess the question is more health for the money. How do you get more health for the money you invest? Understanding that the money you invest is very small, but it's not either or, you need to do both. And on that point, on more health for the money, I have to say, we need to go back to, the basics. And we heard Michael say, 30% is the target for, primary health care investments. But the systems are not basically designed for that. The systems are designed to, prioritize tertiary care, to prioritize secondary care. And we need to change that. We need to change that dynamic. And we need to make sure that, when you go to, your primary healthcare physician, you do have a physician that is in charge of your health. You do have, that point of care with everything they need. And that means telemedicine, that means, point of care diagnostics, that means, electronic medical records connected, with the referral to the secondary and tertiary care. But that needs to be, the basics of the system. We cannot keep investing on, infrastructure, keep investing on tertiary care. We need that. Yes, we do. But we will not get the biggest bang for our buck unless we focus on, this initial first level that is, able to resolve the problems of the population. And the second point I would say in terms of how you invest is, let's not forget that we're just talking about healthcare here. And we should not forget the determinants of health. We should not forget that health is actually the result of a cross-cutting, dimension. And you need to talk about, what about, the other elements of the government, how they could actually contribute to a more healthy society. So I'll stop there, and I'm very much looking forward to the discussion.
Thank you very much, Javier. I'd like to remind everyone that we invite participants to submit questions using either the Q&A function in Zoom or by emailing at meetings@thedialogue.org. And we already have received several questions. I'd like to ask the first one to our speakers. The pandemic clearly drove an increase in health investment in the region, but there's still a clear gap between the current infrastructure and our actual needs. How big is the current gap in terms of investments? I wonder if Antonio Vergara would like to answer that question, given that he spoke a lot about infrastructure.
Yeah, absolutely. Thank you very much for the question. I believe there is a tremendous gap still to be filled. I was trying to refer again. We've been discussing about the value of diagnostics, and I said before, worldwide in developed countries like in Germany, for instance, is 2.5, 2.1 the investment that we have in diagnostics. And in Latin America, as I referred before, it's only 1%. So we need to make sure that at least we achieve the basics. Yes, it's good that we have the initiative to actually increase the level of investment, but how do we invest that is extremely important. Again, we need to make sure that we cover the basics. And to me, covering the basics is the ability to have that infrastructure that is going to allow us to respond to what we currently have now. If we're not able to cover what we have now, it will be impossible to be ready for potential emergencies in the future. That is one thing. And Javier was mentioning very rightly so. I remember the fact of the possibility of having telemedicine before the pandemic was almost unthinkable, almost forbidden. And then all of a sudden we accelerated that to actually put it in place. So that is going to be a call to action to make sure that the surrounded system to really support a successful telemedicine, it will be crucial. Where IT data will be extremely important. So we need to make sure that we continue filling the gap of investments. And that is not going to be possible from any company to do it alone, not even all the industry doing it alone. I mentioned briefly, like if we invest more in prevention, in screening programs, the better will be the money that we use in trying to treat diseases that are being developed a little bit too much at the point that we want to take care of them. So I guess those are the different things that we need to keep on thinking about and really to keep the dialogue in, but with true actions to take on to move forward with them.
Thank you. I have another question. What are the ways to target vulnerable populations with health services? Any lessons learned and best practices so that in the future, the region is more resilient? Well, that's like the million-dollar question. Who would like to address it? Javier, maybe?
Well, I'm happy to have a go at it. I guess the first point I want to make here is, we come with history in terms of this pandemic, and we come with, problems in our region, and the problems are, inequality in access to healthcare, education, nutrition, vulnerability, social exclusion, social discontent, informal and precarious forms of employment, weak social protection systems, and that basically means, recipe for disaster. So that's the historical, baggage we come with, and then we've seen how COVID has disproportionately affected those who are, at risk. So we, I guess, need to go back to equity and being able to prioritize those disadvantaged populations. How do we do that? Well, the first thing I have to say is going back to the financing, we need to focus on reducing the out-of-pocket expenditure. The out-of-pocket expenditure is it is a key problem that will lead people to poverty, catastrophic expenditure due to health. And we have some countries that are just not raising, not solving, not trying to tackle the issue. And that has to do with investment, public investment, but it also has to do with how the investment is made. So when I see countries like, Mexico disbanding, the Seguro Popular, I just feel, the social protection is not there for the disadvantaged people. So one is, as I said, dealing with the out-of-pocket expenditure and the catastrophic, risk of falling into poverty because of health expenditure. But the second one I would say is, if you look at, the risk factors, and if you look at the determinants of health, we're talking about, again, look at how obesity, how mental health, how underlying conditions are primarily affecting disadvantaged populations. So my plea is not only to increase the social protection, but to deal with the risk factors, and deal with the risk factors before you need to deal with the treatments. And of course, back to the final, when you actually get to the patients, then it is about primary healthcare that is able to solve problems. Primary healthcare that is not just referring. In a lot of our countries, people see the general practitioner as someone who's going to give me a referral, someone who's just going to give me Panadol or acetaminophen and a referral. And we need to change that. We need to be sure that it's not just the physician, but you have the nurse, you have all the healthcare professionals that are able to resolve the issues of this patient who comes. Thank you.
Thank you very much. Yeah, oftentimes a strong primary healthcare system is defined as that can solve around 85% of presentations before, and only 15% should be a referral. We have Antonio, I don't know if you have a question or you want to answer.
Yeah, no more than answer. I love the answer from Javier, and I wanted to complement what he's referring. And one of the things that we need to look at that is that from 2000 to 2009, health spending in low-income countries was financed primarily by out-of-pocket spending with 44%, with an external aid of 29%. And as external aid increased, government spending decreased in recent years. So that is a real concern. In contrast, government spending dominated in high-income countries of about 70%. So I think it's something that we need to start segmenting the different realities that we have around the world. And just in my view, like what is the $1 million question that you had? I think that as Javier said, prevention and the primary care services is necessary to invest in there by implementing screening and diagnostics programs supported by innovative testing that allows for timely detection of diseases. Is one way, it's not a formula, but it's actually a very important way. We can deliver treatments when they are most effective and cost less to the entire system. And the second thing that I would say very quickly is that we need to invest in the creation of a digital infrastructure that connects all health systems and enables adoption of personal health care without the database care. This will help ensure better outcomes for patients and health systems while also improving our understanding of disease behaviors among different populations. I think it's critical to expand our reach. I don't believe that it will never be enough the money. And now with the different restrictions that we have based on economic situations as a consequence now of a bellic situation that we have around the world, funding will continue to be an issue. So we need to look at ways to expand our reach by utilizing new ways to do so, like digital solutions, for instance.
Thank you. There's a question that, all of you could address, but I'd like to give the chance to Dr. Yahaira also to address it from her expertise in pharmacoeconomics. So what role do you believe private investment should play in the development of the health system in the region?
I think the private investment have a role to play because when we think in financing the health system, we have maybe fiscal financing, we have taxing some goods, external funding, and also private funding. I think it's very important to incorporate private financing in the system. It could help public-private partnership, but it has to be suitable for the country where they are doing the investments. sometimes some of the investment is in big structure, hospital, tertiary care, and maybe that's not what the country needs. And also there are some countries where there is not the willingness to accept private contributions. For example, in Venezuela, the government control everything in health. It's very difficult to try to make a partnership with the government. So that can be a limitation in some countries, but I think it's a way to do it. It's necessary. It's very important to change the prioritization of how the fundings and spent. It could be a good way to go.
Thank you very much. I'm going to move to another question. With the Summit of the Americas coming up and the reality of the low priority to finance health, how do we advocate on the need to invest in health? How do we talk the talk that politicians will understand and take action? And how do we convince and speak a language that will resonate with politicians so that they can take that action?
Anybody in particular, or actually? I can take it on.
Okay.
I think it's a great perspective. And I think rather than trying to come up with a perfect plan, we need to master the basics. And to me, master the basics is really commit to these kind of dialogues. Start promoting exactly what we want to accomplish as part of the ecosystem. And I think for politicians and for governance in general, it's extremely important to show, for instance, the works of Dr. Javier, because I believe that healthcare economics should prove that is for the good for population and for the good of the health economics at the end of the day. So we should be able to have a more sustainable possibility of having the economies if we're able to invest smarter. And the ability that we would be able to do that is if we promote these kind of events on a regular basis. To have to put ourselves in front of decision makers, of policy makers, and that we present with evidence and not to be misunderstood by a commercial approach. If we're able to present the ecosystem as such, I am pretty sure that everybody can see the benefits of addressing it as a whole.
Mm-hmm. Anybody wants to add anything in additional? We have lots of questions.
I will add that for the summit, we have to learn from this catastrophic public health emergency, and we have to be prepared for the next one. I think if the politicians don't understand that if they have to keep the health of the people, because if the people doesn't have the health, the economic of the whole country is going to suffer. Many countries in our region suffer because the people are working in informal environment. So I think we have to stress that the people need health and we need well spend money in health.
If I may, Arashu, just make a couple of remarks. I want to make 2 points. The first one has to do with, countries, governments are committed or were committed to the Sustainable Development Goals and the conversation on universal health coverage. That could be seen as a dead horse, right? Like, what are you talking about? What do you mean universal health coverage? Now the priority is, pandemic preparedness and global health security, or, rebuilding the economy. But going back to, the why, health systems are important in the first place, why, universal health coverage is important in the first place, and why, healthy people build healthy economies, which in turn invest in better health for their people. is what I think we need to come back to. And we should not be distracted by the fact that, people might want to, go with, the immediate response to, the economic disaster that we have. And of course, the best way to avoid this from being a deeper problem and a social, economic problem is to make sure that the basics for health are in place, and the commitment to universal health coverage comes back, and that means financial protection. That means public financing. That means reducing out-of-pocket expenditure. So that's the first point. The second point is we haven't said much here about the work governments and we all should be doing as a region. And that is, something that is very important. The regional work was not really successful, at least at the beginning of the pandemic. And we see how every country had, their own, negotiations with the vaccine manufacturers, how the platforms that we have were not used appropriately, how the regulatory agencies didn't work together, how, the surveillance didn't actually work in a network way. And I think that is the work of, the region as a region. It is of extreme importance. And that has to do with the financing, that has to do with, the leveraging, the assets that we already have as a region. And I think this is an important window to discuss those possibilities. Thank you.
Thank you. Another question, shouldn't the issue of investment follow a serious review of the business model of health provision? More emphasis on primary health is cheaper and reduces the load on specialized institutions. However, that is less sexy for providers. It's going back to the importance of primary healthcare, of course.
I'm happy to have the first go at that. I think part of the challenge is, we have growing middle classes, and growing middle classes want to have what in Colombia someone said is the Toyota model, which is basically todo para todos ya. That means Toyota. So everything for everyone now. And that is just unsustainable, is just not viable. So there's a lot of work that needs to happen in terms of, working with, citizens, society, civil society organizations. I mean, this is a global, a national, public good. So if I spend money that I should not be spending on my health, someone else is suffering because of, that expenditure. So there's a lot of work that needs to take place in terms of own the system, in terms of own the finances, in terms of own the way money is spent. And that has to do with, the legitimacy of how decisions are made, the transparency of how decisions are made, the stakeholder participation in terms of how decisions are made. I mean, we cannot say, this is excluded from the package if you're not part of the conversation, if you don't know why, that decision was made. I think a lot of work needs to take place in terms of making sure that any priority setting process, any decision that's made is inclusive, has participation, has transparency, and it gives predictability, again, to all the constituencies. So again, in health technology assessment, as the Dr. Bastardo would say, there's as an interesting saying in terms of everyone can have their say, but not everyone can have their way. And we need to, prioritize interventions, prioritize, what will give us as a society the biggest bang for the buck. But again, there's work that needs to happen for the decisions to be legitimate. Over.
Thank you. What recommendations are there for balancing investments in innovation with much needed investments to address the current limitations the region faces that Jahaira mentioned, like the lack of technical knowledge, lack of data, segmented healthcare infrastructure?
I think we have to pay attention to the value framework, try to work on value framework to decide how can we take decisions that take in account all the stakeholders of health. Because otherwise we will spend in no balanced situations. So I think we have to put attention to primary care for in the first instance, but we have to take some value framework to incorporate that innovation that will want to get reached to the market. And if the government doesn't take the decision, maybe the people will get like judicialization of health. So I think we have to put a balance. And in primary care, I think also it has to be addressed how we prioritize the spending, because something that is not taken care in primary care now is mental health. And I think this is a key point from the pandemic going on.
Thank you. Anybody wants to add anything additional, or we still have plenty of questions that we haven't addressed yet? Okay, so I have one question here. It's in Spanish. Sobre la capacidad diagnóstica, es muy importante invertir en este área en pruebas que comprobadamente mejoren el pronóstico del paciente, pero también es importante pensar en una solución para la solicitud de pruebas innecesarias, que es rutina en Brasil, por ejemplo. Es necesario asegurar la práctica de la medicina basada en la evidencia para optimizar los recursos financieros de los sistemas de salud. ¿Alguno de ustedes puede comentar estrategias para lograrlo?
¿En español lo abordamos, doctora?
Como quieran.
Es un excelente punto. Y haciendo reflexión a algunas palabras, si me permite abordarlo. Yo había comentado que la necesidad de invertir mejor además de invertir más, era indispensable. Esa misma lógica la aplico a la habilidad para hacer el testing. Es decir, creo que no hay que promover testear, valga la palabra, a más personas. Hay que testear mejor, que es diferente. Y con eso viene hay herramientas que nos ayudan a tomar ese tipo de decisiones, donde vienen algoritmos específicos que están direccionados a detectar mejor. Nosotros no queremos que se gaste más en test, queremos que se utilicen mejor los tests. Y eso nos va a permitir realmente contribuir al tratamiento de una persona como tal, al abordar la enfermedad como tal. Eso para mí es crítico. ¿Qué se está haciendo como la pregunta? Pues eso, incorporando herramientas de inteligencia artificial, por ejemplo, elaborando algoritmos que nos permitan llevar a mejor testing y a mejor resultado, mejor prevención y mejor tratamiento. Lo estamos disponibilizando y estoy hablando como industria, no como Roche. Se está disponibilizando en muchos centros de cuidado de salud hoy en día. Usted mencionaba la relevancia y el balance entre especialidades y primary care, y yo con esto lo ligo también. Yo creo que hay que seguir abundantemente preparando. Los gobiernos no creo que tengamos, el sector público no tendría que tener esa discrepancia de mentalidad de no invertir. Si al final de cuentas el tratamiento, el bienestar del paciente está como bien común. Cuando yo me voy al privado, la evolución y el renacimiento o el surgimiento de modelos de negocio como es la verticalización, eso nos llevaría a que el cuidado de la salud tenga un balance casi natural. en donde la inversión en la salud del paciente sea la adecuada. Y ahí viene el diagnóstico como tal, en donde se deje de recetar una batería de test y se recete los tests adecuados, en donde realmente nos dé la información adecuada para que el decision making sea lo más adecuado posible.
Muchas gracias. Thank you. We have several questions that unfortunately we cannot address. We do have in one of the comments a reminder that maybe investments should also be guided by the social determinants of health. And I would like to remind everybody that the recording will be available. And if you have any questions, please feel free to contact the dialogue. So thank you everyone for your participation and for the questions that so many people have asked.